C5, C6 disc bulges, poor posture, and associated symptoms like numbness and tingling into the arms. That's the focus of today's episode 11 of Ask Dr. Walter Salubro. As you can see, I'm in a little bit of a different setting as opposed to inside my office, and that's because today's a holiday, but I still want to get this video out to you, like I promised, daily, for as long as you feel it's valuable for you. So if you think it's valuable, do comment below, and if you have a question, perhaps your question may be answered in the next episode of Ask Dr. Walter Salubro. So let's get right into it. Here's the question today, episode 11. This is by Mr. Sandhu, and Mr. Sandhu has been an avid follower of my channel. He asks a lot of questions related to cervical disc bulges and C5, C6 disc bulge. So I'm going to change the direction of the series to away from the lumbar spine into the cervical spine today. So out of the plethora of questions I got from Mr. Sandhu, I picked two that I'm going to focus on inside this video. So here they are. Mr. Sandhu asks, which posture puts stress the most on C5, C6? And since the C5, C6 disc bulge causes tingling and numbness in the arms to the hands, can arm motions also affect the C5, C6 disc bulge or not? Very, very good questions by Mr. Sandhu. Thank you for posing those questions. So first of all, let me address C5, C6 disc bulge. That's an injury in the mid-cervical spine, a disc injury. The spine is designed a little bit different in the neck as it is in the lumbar spine. The neck has a circular shape, so it approximates the segment of a circle according to normal ideal alignments, and the discs are a lot smaller. Nonetheless, they can get injured and bulged, and a lot of times associated to either bad posture contributing to it or a bad spinal alignment. The spinal alignment can be a reversal of the cervical spine like a kyphosis, a reduction of the cervical spine like in a military neck or a straight cervical neck, can also be forward head position, also side to side shifts and tilts as well, plus traumas and so forth. So when there's a C5, C6 disc bulge, some of the common abnormal postures that can stress that area of the spine and that injured disc is a forward head position. So basically, let me see if I can do this. So heads forward like that, forward head position. That will add more abnormal load on those injured discs, and that can cause more injury to the C5, C6 disc area, okay? So that's a bad posture position. A slouching or rounding of the upper back, which can lead to a forward head position, is also another problem. And then there's some things that need to be addressed with x-rays that may not be purely postural, but can also be alignment-based, which I mentioned earlier, which is a reversal of the neck curve, such as like kyphosis, a cervical kyphosis, a military neck, which is a straight neck, okay? Or any side-to-side shifts or tilts, okay? Those are all different posture scenarios and alignment scenarios that could contribute to a C5, C6 disc injury. So the other part of the question was when a C5, C6 disc bulge irritates the nerves in the mid cervical spine, lower cervical spine, and it causes tingling and numbness into the hands and arms. Can motions of the arms also affect the C5, C6 disc bulge or not? That's a good question. So the actual motion of the arm will not directly affect the C5, C6 disc bulge or the C5, C6 area. However, if there's a disc bulge injury, there's inflammation in the area, the nerves, the C5, C6 nerves in that area are being irritated, are being compressed. You start to stretch your arm out, move your arm out. Indirectly through the muscles that connect from your neck and shoulders, you can affect those inflamed areas as well. You begin to stretch your arms out, then you could irritate and tension the nerves that are connecting to that C5, C6 spinal cord area and that are either compressed between the vertebra at C5, C6, or perhaps there can be a neuroforaminal stenosis or narrowing of the neural foramen where the nerves come out of. So you're moving your arms in different directions. It can actually irritate those nerves, and indirectly through the muscular attachments of pulling the arm can affect that area of the neck, okay? A lot of times I've seen where patients have an inflamed neck due to disc injury or spinal distortion in the neck area. Just the weight of their arm actually affects their neck. So they have to hold it upright like this because it's stretching out those nerves and muscles that are associated with it. So it's not that an arm motion will directly affect the C5, C6 area, but when it's inflamed and irritated, indirectly through those muscular attachments and also through tensioning the nerves that associate from the C5-C6 area through the brachial plexus into your hands and arms. That can also irritate that, okay? So that's the answer to today's question of Ask Dr. Walter Salubro. And if you're looking for more in the series, the first 10 episodes, you can binge watch them right over here, right there, boom, okay? Go watch the playlist and come back again. Subscribe if you're brand new to my channel and you're following me as a first-time viewer. Subscribe so you get these videos on a daily basis.